Imagine you are with someone, and they suddenly feel very unwell. You might immediately wonder if it is a heart attack or a stroke. Many of us believe we know the classic signs that tell these two apart. However, what most people think they know is often incorrect. Perhaps you felt that sudden tightness in your chest while reading at home. You might recall an article you saw online explaining the differences. It suggested a heart attack feels one way and anxiety feels another. So you try some deep breathing exercises you learned from a website. But the pounding in your chest continues, leaving you feeling even more unsure. Or maybe your heart started racing while you were out running errands. You tried to dismiss it, thinking it was just stress from a busy day. You believed the signs of a true heart problem would be far more dramatic, but a small persistent thought may have surfaced in your mind. It quietly asks, what if this isn't just anxiety? Am I ignoring a warning sign? Many people try to calm themselves when these symptoms appear. They may assume it's simply anxiety that will pass on its own. But this common coping strategy can be a dangerous gamble. When it comes to your heart, every single second counts. Waiting to see if you feel better is a risk you can't afford. In that moment, it's natural to tell yourself not to overreact. You might try to rationalize the feelings to avoid a hospital visit. But this sensible-seeming choice could close a vital window for treatment. Learning to spot the differences isn't about causing alarm. It's about giving you the confidence to take the right action. You might believe that a panic attack feels completely different from a heart attack. But the surprising truth is, their physical symptoms can be nearly identical. Imagine your body has a single, powerful warning light on its dashboard. That same light flashes for a serious engine problem, like a heart attack. But it also flashes for a faulty sensor, which is similar to a panic attack. The American Heart Association confirms that both can cause chest pain, a pounding heart, and shortness of breath. So your body is sending the same urgent signals for two very different events. So, how does this happen in the body? Think of it like your body's own emergency alarm system. A panic attack is like a false alarm that suddenly goes off. It floods your system with adrenaline, the fight or flight hormone. This causes your heart to pound and your chest muscles to tighten. Imagine you are sitting calmly in your favorite chair, reading a book. Suddenly you feel intense chest pain and your heart starts racing. Because the symptoms are so similar, you can't be sure what it is. Think of it like a fire drill happening inside your body. The emergency alarms go off without any warning. Your heart pounds and your breathing changes to prepare for danger. But in this case, there is no actual fire to escape from. This knowledge effectively brings you to a crossroads. From this point on, your choice is what matters most for your health. If you're over 55 and this is your first time feeling sudden chest pain, call for help. This also applies to new shortness of breath or a pounding heart. Please call 911 immediately, as these can be signs of a heart attack. Getting checked right away is the safest thing to do. Now, if you've had these symptoms before and a doctor ruled out a heart problem, take the next step. Schedule a follow-up visit with your primary care provider. You can talk with them about the possibility of a panic disorder. Together, you can create a plan to help you manage these feelings. For those with a diagnosed panic disorder, start with your established treatment plan. However, it is important to notice if anything feels different this time. Call 911 if symptoms are more severe or last longer than usual. You should also get help if the attack feels unlike your previous ones. Remember, your peace of mind is always worth making that phone call. If this information was helpful,